coming in to mute their microphones, that would be great. Still a few more coming in.
Can you mute it?
Okay, let's get started. Hello, I'm Dr. Ruben Rakova, a pediatrician from Pediatrust, and I'm your moderator for tonight's live Q&A session, The Holidays and COVID-19, Celebrating Safely. Joining me on the panel tonight are three of Pediatrust's pediatricians. First, Dr. Jonathan Kaufman from Pediatric Associates of Barrington with offices in Barrington and Crystal Lake. Dr. Dimple Damani from Pediatric Partners with offices in Highland Park and Vernon Hills, and Dr. Rachel Goodman from Elm Street Pediatrics in Winnetka. We got a lot of questions that have come in by email from our registrants over the past few weeks, and we'll try and get to as many of those as possible. Those of you on the call tonight can also send in questions live, either through the chat function for those of you on Zoom or through the Facebook Live. And don't worry, if you missed something on the session tonight, we are recording this. And over the next few days, we'll be sending out an email to all of those who registered with a link to access the recording. And there'll also be some references that we mentioned in tonight's presentation that will also be included in that email. The recording will also be available on our new and improved website, pediatrust.com. We'd like to respect everyone's time, so we'll try and end this session promptly around 7. As a preface, before we begin, let me say that the surge that you have been hearing about, reading about, and seeing stories about in the media is very real. We're all feeling it very much. We're seeing rising cases among our pediatric patients. The positivity rate in our area is around 15% now. And at all of the hospitals that we are affiliated with throughout Pediatrust, they're seeing a lot of cases and a lot of serious cases with overflows into the ICU and a shortage of hospital beds and ICU beds across all of those hospitals. It's not fear-mongering to say that we all need to be as cautious as possible. What is also very real, we realize, is COVID fatigue. Everyone, including everyone on this panel, is tired of it. We're tired of the restrictions. We're tired of mask wearing. We're tired about the rules against gathering with others. But we have to remain vigilant to protect ourselves and our families, and especially those who are most at risk, the elderly and those with chronic illnesses. So the advice you hear tonight has been very carefully considered and is based on the best evidence to date. We don't make any suggestions without thinking about the consequences. But this is a fluid situation, as we're all aware, and the situation may change between now and the end of the holiday season. We've gotten a lot of questions about the safety regarding the type of travel over the holidays. For example, a plane versus a car, and which places are safe to travel, this state or that state, whether they're on the hotspot list or not. But I would say we should step back and ask a more basic question. Should we even be reconsidering getting together with extended family and friends at this holiday season? How unsafe is it to gather in a home with people besides those that we've been living with for the last 8 months during this pandemic? We know that the surge that we've been seeing this last month or so has not been driven by schools reopening or by restaurants. It's really been driven by small, informal gatherings in people's homes, birthday parties, baby showers, other informal gatherings. We feel safe when we're around friends and family, so we often relax the mask wearing and social distancing rules, and that's the driving force behind the surge. People aren't getting sick at the grocery store or the schools, they're getting sick from small group gatherings in their homes or the homes of their friends and families. A link to the Washington Post article that talks about this will be included in the email that goes out. And that's why this holiday, we need to think very, very hard about whether getting together with extended family or far-flung friends is the right thing to do. I'd like to hear from each of you on the panel um, and have you weigh in on this. Rachel, let's start with you, and then we can go around the rest of the panel.
All right, thank you for having me, and thanks for everybody being on the call. So first of all, I completely agree with what you just said, Ruben. And I mean, I'm encouraging everyone to rethink their plans for the holidays. I've canceled my plans for the holidays. At my own family, we're just going to be celebrating with my own family. We'll Zoom or other stuff, but no one's coming in town this year. We're not even seeing my mom, who lives locally, because she's not in our household. So many of my answers are coming from the CDC website. They have really good resources, and the 2 pages that helped me prepare for this are traveling during the COVID-19 pandemic and holiday celebrations and small gatherings. And I think we'll have links to those as well with what we're sending out. So I'd also like to reiterate the high numbers that we're seeing in the office right now. And if you're getting together with anybody outside of your home, remember, wear a mask, watch your distance, and wash your hands.
Let's go in clockwise formation here. Then I guess, Dimple, you're next.
Thank you for having me, Ruben. I completely agree with what my colleagues have had to say. The gatherings this holiday season should be small, limited to the people that you live with or the people who you formed a pod or bubble with. But remember, your bubble is a closed circle. Those in your bubble should not be gathering with other people. And this holiday season will be difficult for everybody, but next year is going to be better. By next year, we should have an effective vaccine. Perhaps there'll be better treatments and quicker tests. This season, let's think of alternative ways to be with our extended family. Let's utilize technology. We have Zoom, we have FaceTime. Obviously, it's not the same, but it is a way for us to be with our extended family. I know this is, and yeah, let's just continue just to watch our distance and not be in large groups.
Jonathan?
Yes, thank you. And again, I think it's an honor and a privilege to be asked to be on this panel. I would say that it's probably the understatement of the year that this is a topic that is on everybody's mind on a regular basis. And I think that the choices are unique within each family. I think one of the things that you'll be hearing a lot about in this hour are the phrases bubble, pod, and ripple, and how that impacts each individual family and what the risk factors are within that house and household in terms of allowing you or to make your decisions on what is best for your holiday. Having said that, there are certainly some best practices, things that we'll talk about over the next hour that would definitely make your season as safe as possible and as joyous as possible.
Thank you all. So as some have pointed out, that approach that we just discussed, isolating with the same pod that you've been with for the last 8 or 9 months, not seeing family this holiday season, that approach is not without its consequences. One parent wrote in and worried that such isolation will negatively affect the mental health, not only of their children, but of ourselves, the adults. Dimple, what advice do you have for that parent?
So I completely agree. I mean, the concern over people's mental health is a valid concern. This holiday season, where we're not saying that people should be completely isolated and by themselves, we are saying to gather with your nuclear family or small pod you've already been gathering with. If you're already seeing grandparents, then it's okay to have Thanksgiving dinner with them. It's the cousins, the aunts, friends you haven't seen in months who are the ones who should not be physically in the home with you. As I mentioned before, use technology to involve those who physically can't be with you. And just remember, as adults, have a positive approach to the situation. We can be a role model for our children and tell them that, yes, this isn't the traditional way to gather and celebrate the holiday, but let's try to brainstorm ideas on how we can make this holiday season more memorable.
That's a good point. I would say one other thing on a personal note. I have several daughters, some at college, one 18-year-old who's here at home with us. And she has been, like all of our teenagers, complaining about the inability to get together with their friends. The one thing it has allowed us to do is to grow a little closer as a family, because now it's just my wife and I and her, and we're finding things to do every night on the weekends that we can do together. It's not a substitute for her peers. I understand that. But then we can allow her peers to get together on occasion. Like Dimple said, this doesn't mean you have to totally isolate and never see anybody. Teenagers are a little bit sturdier than most adults. You open up the garage, take the cars out, maybe get an outside fire pit, have them all masked and sitting outside for an hour or so around the fire. They can do that. And that's a way for them still to get together while still being safe. So there can be creative ways to do this. You just have to figure out some of those ways that work best for your family. All right. Another parent wants to know, what precautions should they take if they plan on sharing a house with another family for part of the holidays? Jonathan, what's your advice?
So I think as we are finding out that the most likely mode of transmission is close contact within indoors and in close quarters. So I think depending on your situation for the holidays, if you have to share a household, then there are definitely some precautions that you should take to minimize any risk of exposure. So for example, if you have a family that's coming into your household, it would be nice to know that their bubble is clean, that they have been either tested and tested negatively or aren't harboring any symptoms. Once they do come into the house, if you made that decision, if there's a way to socially distance, mask, and isolate when the families are not together. So for example, if your house is such that you have more than one bathroom or multiple bathrooms, you could identify a bathroom per family, and that family would use that bathroom. Each individual would use the bathroom clean around its use so that there wouldn't potentially be cross-contamination between or among families. Not sharing utensils, not serving platters, having as much outdoor activity as possible would be most beneficial. Opening windows as much as feasible to allow air circulation. In close contact with other family members, if there's a table that's big enough so that each family or each pod puts distance from each other, maybe sit at different ends of the table. Again, not sharing utensils, cleaning down surfaces. As we know, there is some transmission of the virus that can be left on surfaces. So cleaning surfaces around contact and using your own set of utensils. Those are the ways, if you have to have contact and have families stay with you, those are the ways that you could potentially decrease the risk of transmission within that household.
All right, thank you for that. So we actually got a question that came up on the chat, and this is very important. I think it's a question that's probably on a lot of people's minds. One of our attendees asked, my daughter's coming home from college. Which type of COVID test should she have? And she lists several of them. The next question is related to that. What is the best timing for testing college students returning home, assuming they might have been taking socializing risks at school prior to returning? My understanding is testing is not as effective the first few days after exposure, and one should ideally quarantine and test on day 4 or 5. Is that correct? A lot of questions about testing also came in over the last few weeks. So Rachel, what can you tell us about the different types of tests? And is there a way to test for COVID safely and be sure that everyone is quote unquote COVID free for a week's trip? Is that even safe?
Okay. And I'm going to address the college student timing at a later time with the question, but first of all, just to sort of explain the different kinds of tests, there's the rapid antigen test, and we can do those in all of the Pediatrust offices. Those are very accurate if you have symptoms. PCRs are more accurate, but they're harder to get. All Pediatrust offices have the rapid antigen. The PCRs, some of the offices can put in an order for the test and others can do it and send it out. The main thing about that is I would just say, a lot of times the school just as a blanket say it has to be a PCR. The problem is if everyone gets a PCR with any kind of contact and any kind of runny nose, we're going to overwhelm the system. And so one of the reasons why, it's important to talk to your doctor about this is just to find out. Sometimes a rapid antigen, if there is just a runny nose, is fine, because the antigen test can be about 95% to 98% accurate if there are symptoms. So in terms of type of testing, talk to your pediatrician about that. Again, I'm going to address the college students later, so we'll talk about that at that point. But I just want to go back to the testing. So the most important thing is just to remember that a test is just one moment in time. It doesn't tell you what you were 3 days ago, and it doesn't tell you what you're going to be in 5 days. So I was going to bring up an example, and it's just a small example, but I've had people, a family tell me about a wedding where people came in from out of town. Everyone got tested before they came in, they were all negative. Everyone got tested the first day they were there, they were all negative. And then there were various events. Everyone went home and 4 people were positive. And the reason it affected us is one of those people saw a family of ours before going home. And, and again, the ripple effect, if they cause them to be positive, who are they going to cause to be positive? And the most important thing is that many people who have COVID-19 don't have symptoms. So they can spread it to people that they love and care about without knowing. So testing, as we just talked about, is more helpful diagnostically when either you have symptoms or known exposure. So if you're using it just to give you, just to do before traveling or before having a family event or before having a large gathering, it's actually giving you, it could give you a false sense of security, because you could be negative at that moment, but it doesn't tell you what's going to happen for the rest of the time that you're there.
Yeah, I would just add, and as a way of answering that second question, it is one piece of the puzzle. It is not in and of itself the be all and end all. Just because you test negative, that doesn't mean that you won't be positive a couple of days later, a day later, heck, 3 hours later. So you shouldn't rely just on that. The one question that came up was, should they be quarantined first? Yes. If your college student is coming home, as many of them are, for the next 2 months, right? They're coming home at Thanksgiving, but they're not going back until mid-January, like a lot of colleges. Then it would make sense to have them quarantine, meaning wear a mask when they're in the house, try and eat separate from everybody, try and socially distance when they're in the home. Test them 5 days after they leave campus. Day 5 will give you the most reliable results. Day 1, 2, 3, not so much. And if they're negative, they still would need to be quarantined for 14 days. But at least you can rest a little bit easier knowing that, okay, so far so good, we're negative. And then after the 14 days is over, no need to repeat the test. Just say, okay, you can come out of your quarantine, take off the mask, and we're good to go.
And actually, I was going to also add, a lot of schools are testing on campus or offering that they can do it. So if they can get it when right before they leave, that would be great. And then, with that combined with quarantining before coming home, or really limiting social activity the 1 to 2 weeks before coming home, being careful about how they're traveling, and we'll talk about airports, train stations, gas stations. Have them wear a mask at home for up to 14 days and get that test at 5 days. Basically, yeah, exactly.
That's all good advice. Okay, speaking of flying, some college students have to fly home, obviously, and some of you may be flying during this holiday season. So what recommendations do you have, Dimple, for safety precautions to take when flying?
Sure. I mean, unfortunately, with the prevalence of people infected with COVID increasing drastically over the country, over the world, airline travel has become more risky. That said, most airplanes most airplanes do have good air filtration systems to help clear the air of germs, viruses. But social distancing, it's difficult on crowded flights, and typically you're sitting within 6 feet of others, sometimes for hours, and that's a risk factor. But if you choose to fly, you don't have a choice. Make sure you're wearing a mask the entire time you're on the flight, sanitize the seating area around you, and wash your hands very frequently. As you're traveling to the airport, make sure you are keeping a distance. When you're in security lines, try to keep that 6 feet distance from other people, and continue to avoid touching your mouth, eyes, and nose.
Thanks. All good advice. Jonathan, is 6 feet apart still acceptable this winter when outdoors?
So let's sort of briefly review what we've sort of mentioned. So one important thing is that testing is a point in time. The other things to keep in mind is that people can be symptomatic with the virus and they can also be asymptomatic with the virus. So having said that, if you think about this ripple effect, that if you have this beautiful, serene, glass-looking pond and you drop a stone in that pond and that happens to be a COVID, it's going to ripple out and affect everything in its path. And if you drop several stones in that same pond, you're going to create a lot of turbulence and a lot of damage. No question that ventilation, outside, masking, hand washing, and social distancing are best practices and ways to try and minimize any of that ripple effect or that pond. So that outdoors is safer than inside. 6 feet apart is certainly safer than less than 6 feet apart. Having said that, the masking and hand washing and rubbing down surfaces are two more very, very important aspects of that. So I think one of the disadvantages is that you have a family and those family have small children and those children are either too young to mask or unwilling to mask, then you're sort of creating a potential for transmission of asymptomatic individuals, and that can be a problem.
Thank you. That's a very Zen metaphor you come up with about the ripples in the pond, but I think it is apt. We need to understand that even the small things that we do in our family, in our life, in our community can ripple outwards and cause consequences beyond what we can imagine, and we see it every day. All right, as a follow-up, one parent asked, we socialize a lot outdoors. The kids are unmasked, but we aren't too close with a group of 12 parents and 6 kids. So Jonathan, what are your thoughts on that situation?
So again, if you've got 2 different pods and both pods are clean, and we know that for a fact, then them being together is not such a bad thing. However, you've got children that are unmasked and we don't know for sure whether those pods are clean because of this asymptomatic potential for having infection. Outdoors is safe, but if everybody would be willing to mask, social distance, wash, and clean surfaces, it would be the best way to enjoy that interaction safely. Outdoors definitely versus indoors.
Thanks. Okay, Rachel, we got several questions sent in to us about problematic relatives. First of all, what do you tell a family who insists on traveling here, but the relatives who are here don't want to attend large gatherings? And what about teens who flout the rules because they feel invincible, as most teens do?
Okay, so for the first question, don't be afraid to say no. Blame the pediatrician. I always tell people, blame me. I want you to blame me. Don't go to any gathering that you feel is unsafe. And, I sort of like what Dimple said before, but I read an article that really hit home. It was harsh, but it was reality. Asking, would you rather spend time together this holiday season and maybe not again? Or would you rather spend future holidays together and have, maybe either miss or spend this holiday season a little differently than you normally have? So, yes, if it is not safe, don't be afraid to say no and blame your pediatrician. All right, second question about teens. So the first thing is, when we do testing in our offices and we take histories, I'm like, just my jaw is dropping and I can't believe it. When I'm surprised at how many kids are hanging out with friends indoors without masks. Again, I can't believe it. And people will say to me, they go, but the kids and even their parents are shaking their heads. Well, my son just hangs out with 3 friends. It's just the 3 of them, the 4 of them that hang out together. So the problem with that logic is, hanging out with 3 friends in your basement, playing cards or whatever, is that those 3 kids also have families. And each of those families also have siblings who presumably have 3 friends who also have families, who presumably have friends, and back to that ripple, that it just keeps going. So 4 people becomes 40, becomes 400, just like that. And so, the invincibility of the teens, we just have to keep reminding them.
All right, thank you. Dimple, we're going to go back to a flying question. Is it safe to travel with very young ones, let's say under the age of 1? And are there any special precautions to take with those younger travelers?
So it gets a little tricky with children who can't mask. They're still at a higher risk of getting infected with the virus. While the younger children, babies generally don't get as sick compared to the older kids, there still, of course, is a chance that they become infected and then go on to spread the virus to the people who you're going to go visit, which again, risk increases when you're visiting grandparents and people who are at a more vulnerable age and have underlying medical problems. In the end, you do have to decide what your acceptable level of risk is at this point.
Okay. You know, while you're talking about grandparents, one parent asked on the chat, is it necessary to wear masks indoors if we're going to visit grandparents? Both families are quarantining for 15 days before meeting up.
So, I mean, if you truly are quarantined for the 2 weeks prior to seeing grandparents, then yes, it's safe. But quarantine for people means different things. What really are you doing if all you're doing is going to the grocery store and working from home and really not seeing anybody else without a mask on? Then yes, it's safe. If you truly quarantine for the 15 days, you go to see grandparents, it is safe for the grandparents. Because then, I think there's a really good chance that you haven't been exposed to COVID and bringing it home to them.
Yeah, I think that's a good point. It's unrealistic to, for everybody on this call to say I'm going to quarantine for 2 weeks before Thanksgiving, partly because Thanksgiving is now less than 2 weeks away. But it's just very hard, right? I mean, people work outside the home, kids go to school, it's just sort of impossible. But if you are planning on doing that, you need to make sure that everybody really understands, as Dimple said, what that really means. And that means not hanging out with anybody else. It means not going over to a friend's house, not having people come over. It really does mean kind of just sheltering at home. Have your groceries delivered if you can, those kinds of things. So
every single person in that whole bubble.
Right. Okay, Jonathan, for those who have to travel this holiday season, what are your thoughts on the safety of car versus plane travel? And alternatively, what are your thoughts on a hotel versus something like an Airbnb while traveling?
So I think Dimple made some really nice comments about air travel. I think that when you have small children that are unable to mask or can't mask, and I think the car would be the next safest choice if you must travel. But I think, as Ruben, you've mentioned to us several times, it's not so much where you're going, it's how you're getting there. And if there is a car trip that requires several stops, including potential staying overnight, and we want to make sure that we take as many precautions as possible. Even as places like going into public restrooms, going into public restaurants, touching and handling things, going into gas stations and things like that to refuel. Those are potential exposure spots, and there really isn't anywhere that's not a hotspot pretty much right now. So if you're traveling, you have to pretty much assume that where you're going, there's potential for exposure. So maybe having just one person get out of the car to go to the gas station or get the food at the restaurant or whatever in the carryouts, washing down the bathrooms and things like that. And then the discussion comes up on hotel stays versus either an Airbnb or a VRBO. It really just depends on what your comfort level is with the cleanliness of where you're staying. So most hotels do contactless check-in and check-out. Most hotels do not offer food services anymore, and they deep clean your hotel room, do not do any maid services. So basically you're confined to that bubble, and assuming that you have confidence and faith in that hotel that they're going to follow those best practices, then I think that's a fair bet. An Airbnb or a VRBO is another great choice, but again, you have to be comfortable and confident that the people that you're renting from and the company you're renting from have followed guidelines that are recommended to them in terms of deep cleaning and things like that. Also cleaning the toilets and making sure that there hasn't been any potential for cross-contamination. So how you get there is really the important thing, not so much where you're going. And I think if you can be comfortable and safe with those things that lay ahead of you, then I think given the need to travel, car travel can be done safely.
Thank you. You know, that's a good point you bring up. We've been reinforcing with a lot of our families, it's not so much, like you said, the location that you travel to, it's the behaviors, right? Particularly since our state now is among one of the worst in the country in terms of rising number of cases. If you go to another state and go to a casino, for example, or to Disney World, or attend large crowded places, doesn't matter where you go, those behaviors are bad, whether you do them here in Illinois or you do them in some state in a different time zone. So it's really more about the behaviors than the location. All right, now let's assume we're all going to get through this holiday season, and then what about going back to school? Rachel, is it safe to return to school for in-person learning after the holidays?
So yes, I think it is, especially if everyone does their part, avoiding travel, small gatherings, socially distancing, doing the things that we've talked about. But you can't guarantee that. But I will tell you that schools really don't seem to be the drivers of outbreaks. You've got desks that are socially distanced, everyone's wearing masks, there are people monitoring and preventing bunching up. So it's really what we've talked about, what happens outside of schools and gatherings with people who are outside their household with their 3 friends getting together. So I think even with the anticipated spike that we're going to be seeing or seeing already and continuing to see in the community, it does seem to be safe. As we've talked about, because there seems to be, and I've been looking at it, there doesn't seem to be very much in school spread. It's mostly outside of the school. So, and then another question that we had brought up, you had sent to us that people had asked about sending kids back to daycare, so not just school, so which is a teeny bit different. And I think it still is safe to for sending back to daycare. So the interesting thing, ironically, in our office, we're now seeing many nannies that are getting COVID and spreading it to the kids that they're babysitting for. So I'm telling people that anybody who comes into your home, nannies, babysitters, if you still have cleaning people coming in, tutors, everybody has to wear a mask and socially distance. Anybody who comes into your home has to wear a mask, socially distance.
All right, thank you. And while we're on the subject of school, did you have any other comments about college?
Okay, well, just sort of what we had talked about with, and so the timing, and again, just sort of reiterating those points, college students before coming home should really limit their social activities before coming home. They should get tested before leaving school. They should be careful about traveling home. They should be wearing masks in the home for up to 14 days and recommend getting a test at about 14 days, at about 5 days after they come home, in that 5-day window, but 5 days after they come home.
All right, thanks. Dimple, we have 2 somewhat specific questions about families. So first of all, is it safe for immediate family to hold babies without wearing a mask? And then secondly, a question came in on the chat about little kids, small kids who are good about wearing masks, but they're still small kids, so their noses are known to slip out. I don't want them seeing their grandma this Thanksgiving, and that's pretty wise, I would say. But I would love to spend some time with my mom locally. If I mask and wash, what are the risks to me and to my mom if I do have a visit, and note, my kids are at school in person, would an amount of time make it safer? I'm guessing she means an amount of time to wait till after they're done with school. I'm not sure. What would you say to that mom? And then to the mom who asked the question about holding babies without wearing a mask?
Sure. So I can go and address the previous question just about the mom who wants to go visit her own mother, but doesn't feel comfortable with the kids going with her. And then the kids are in school too. So, again, you want to see your mother, you want to see a grandparent who's elderly. And I get it. I totally agree. If your kids aren't really good about wearing masks in school and, slipping under their nose, they should stay at home. But for you, the safest thing to do is wear a mask. And I really feel like if you go to your mother's house and both you and her are wearing a mask, again, wash your hands before you go over there. When you're sitting with her, if you're sitting in her home, it's too cold outside, open some windows just to get some ventilation going. I think it's safe. Again, both you and her need to be wearing a mask. I don't advise eating a meal or drinking, because that forces you to take your mask off, and there's added risk when you're taking your mask off. So if both you and your mother can keep your masks on the entire time, then I feel like it would be safe for you to see her despite your kids being in school. And then as far as, if you have a newborn, if you have a baby at home, and what to do about immediate family members and them holding your baby, well, if you think about it, even in pre-COVID times, we had to be careful about washing hands and being safe around a newborn. And so it's not that much different now. When we define immediate family members, I think of people who are living at home with the baby. Since this is the baby's family unit or bubble, then it is okay for you, your husband, your kids to hold the baby without a mask. That said, however, if a family member shows any signs of illness, if there's a family member, maybe an older kid who's been not doing the best with social distancing, then that person should be wearing a mask around the baby.
Thanks. Jonathan, what are your thoughts on teens playing indoor sports at this time?
Well, I think when we talk about teams and sports, I think we'd be remiss if we didn't include the other arts and cultures such as dance, music, theater, because all of these cultures are also missing their activities. So let's sort of lump into an indoor activities with your children and their teens. I think it just depends on what the reason that they're doing it for is. So for example, we know that there are certainly certain sports that are involved and other cultures that are involved in close contact. For example, singing without masks, we know that creates a spread, airborne transmission. We know that contact sports can do that. Ice hockey is a big one right now that creates a lot of issues and confusions, gymnastics. Other types of dance types of things, as well as, arts and theater. So it depends on what the reason and the significance of your child's participation in that activity would be. Examples would be if your child is doing something for participation in skill set acquisition, then maybe it's a little bit risky and maybe you want to back off for a little bit. If you have an athlete that's trying to, or somebody who's trying to get a college scholarship in either a sport or a culture, and this season or this year is extremely important, then I think those reasons for participating are potentially a little bit greater. But then I think we look at the risks of those types of activities and how that would impact the transmission or exposure. So what the CDC has done is sort of divided the athletics, to use as an example, into from lowest risk to higher risk. So if you use, for example, travel baseball, an indoor practice season, you could certainly scale that down, and instead of having 25 athletes in an indoor facility with no ventilation and no masking, you could do things like skill building drills at home, or low things in the basement that could hone in and continue to build skills, but it would decrease risk. And then obviously you could do smaller groups if you're having team-based practices. You could do it outside as much as possible, masking, social distancing, and things like that. The higher risk gets into competition and how that would impact exposure. And then obviously, if you're going to have to do competition, if you're within a demographic area where we know the contagion and the risk factors, that would help, but also would potentially confine the virus in that area. And then of course, the highest risk is outside competition. So hockey tournaments in Minnesota or Michigan or Canada or whatever, where entire team travels and shares, they trade off locker rooms and benches and things like that. So it really just depends on what your purpose is for your son or daughter to participate in the activity, what the risk is. If I could just sort of maybe step back, and I think one of the things that, this has all made us realize is that this virus is, there's nobody that it hasn't affected. I mean, from talking about not participating in sports or cultures to people who have lost their jobs and people who have lost loved ones or people who have family members or friends who have had tragedies. So this is historic. This is a generational type of a thing for all of us. And I think one of the things that we can all do is learn from history and see what we can do to maybe change the course of history so that it betters all of us. And one of the things I think that we teach our families when we do pediatric medicine is the concept of teachable moments and how to preach or how to promote resiliency in our families, and how to talk about making sacrifices for the betterment of all of us. And these are all things that we've talked about over the last several minutes that talk about making sacrifices and teachable moments in terms of why maybe it's not a good idea for you to hang out in the basement with 3 friends playing video games without masks, or why maybe we should not do indoor baseball practice this year, or maybe not visit grandma this year, so maybe we can go in the spring. This is personal sacrifice, and we need to get together to try and change the course of history. This is for real. This is a generational type of thing.
Thank you. That's spoken like a very wise pediatrician. I think I appreciate those words. Thanks a lot. Rachel, your kids play.
Okay. I was just going to say, my own son just got COVID. He just came out of quarantine tonight, but and there have actually been more articles and things talking about hockey as a very high risk sport because of the cold inside the rinks, and because it goes onto the ice and it gets churned up on the ice and so on his hockey team. So it actually said it was the perfect setting for a super spreader event. And so my own son, they had a scrimmage, and we did not realize the risk with that. A coach was positive, another coach became positive, and now 6 players on the team are positive. So it was a true super spreader event. And one of the kids on the team actually has diabetes and has been in the hospital at Lurie Children's in the ICU. So these are not without consequences. I've actually sent letters to people saying until they make a mask mandate for on, off, and on the ice. Right now there's a mandate for off the ice, but until there's on and off the ice, I will not send my other son for hockey. So I know it's not a popular thing, but it's a safe decision. And so until those mandates are in place, I have a feeling things may be shutting down even more soon. So it'll be a moot point, but we have to discuss the risks at home as a family. And I had to I working from home for 2 weeks doing remote telemedicine visits. It has been a burden. So everybody needs to think about these things.
Another illustration of that ripple effect, right?
Yeah.
One person is positive, the coach, he infects somebody, and before you know it, there's a teenage boy in the hospital in the ICU. So these things are real. Rachel, since we're with you right now, I'm going to ask you another question. One parent wrote in, how long should we wait to visit relatives who tested positive for COVID?
So a good rule of thumb on this, just in general, and according to the CDC, when someone has been diagnosed with COVID-19, the rule of how long they're contagious for is 10 days beyond either when symptoms started, and sometimes we've just talked about there can be asymptomatic patients, or the 10 days from the day of testing. So, and then there's also, it has to be at least 24 hours fever-free, and the symptoms have to be improving, not worsening. So once you've met that criteria, you are no longer considered contagious. You can come out of isolation or quarantine. Um, the one thing, a lot of people want to do testing to follow up. Okay, I'll do a test to see if I'm still contagious. However, when you do the testing, you can be positive for weeks, even months afterwards, and it doesn't mean you're still contagious. So we have been writing letters in our office for people to go back to work, to be around family, to go back to school. And even the Illinois Department of Public Health, IDPH, they're so overwhelmed, they're no longer doing contact tracing, but what they're doing is they're speaking to all the school nurses, and they're basing on the day that the patient tested positive or when their symptoms began, giving a date to return to school. So, so that's the general rule, is 10 days from symptoms or testing if there were no symptoms, of which at least 24 hours is fever-free.
Thank you. Jonathan, I'm going to ask you two questions. One that came in last week through email, and then one that came in on the chat tonight, and they're somewhat related. So the first question is, how common is either toddler to toddler transmission or toddler to adult transmission? And then the question that came in on the chat tonight is, are there different symptoms to look for in young children under the age of 2 to be concerned with COVID?
So it's great questions. I think that this has probably been the most studied virus in history. Having said that, there's still a lot of information we don't have. I think when we look at toddlers and babies, one of the things that I think they're starting to realize is that if you study children under the age of 5, the amount of viral load or pieces of the coronavirus can be as much as 100 times greater in children under the age of 5 than adults. Having said that, why don't they get as sick as adults, and why are they not as much risk of getting complications? Not without complications, but not as much risk as complications. We really don't know why. So having said that, it's also believed that toddler to toddler or children transmission in that young age is less, and that toddler or small child to adult transmission is less than adult to child or adult to toddler transmission. No one seems to know why. I think that there are theories, and they're kind of technical, but I think the bottom line is that in a child under the age of 5, the symptoms of coronavirus, COVID-19, can look no more worse or ominous than a congestion or a cold with a fever, things that a year ago we would probably not even call our office for. But now, because of the pandemic and the concerns about the ripple effect and things like that, those phone calls are very justified and very important to make. But I think the take-home message is that it really can look no different than a common cold in a young child, and that can be another reason why we should watch our distances and mask if possible.
Thank you. All right, I do want to point out, for those of you who may not be paying as much attention to the chat as we are, that there was a comment in the chat. It wasn't a question, but it was a comment from somebody who obviously works in the ER. Said, in the ER, we are seeing younger people in their 40s, people suffering, and it is not clear when they truly recover. I thank you for that comment. This is something that affects people of all ages. In the early spring, early part of the summer, what we were seeing was the ER was flooded with residents from nursing facilities, old folks' homes, those kinds of places. That is not what's driving this current surge. The senior citizen living facilities have instituted a lot of precautions, and they're actually very, very safe at the moment. But what we're seeing is more young adults, 20s, 30s, 40s. Some of them, the 20-year-olds from college, bars, and just local gatherings where they don't wear a mask. And some of those older 30s and 40s from those informal household gatherings that I said. So this parent who obviously works in the ER is seeing what we're hearing about. So thank you for that. Dimple, I'm going to ask you a question. What are your thoughts about those tents or bubbles for dining outside? Are they really safe? And if not, how safe is it to eat indoors with either a small group in a restaurant or in a home?
Good question. Another good question. So now that the weather is getting cooler, many restaurants have set up these outdoor tents for dining. Now, the safety of these outdoor tents really depends on many factors, but overall, the tents, which I've seen, from the street, it appears that they all have these closed wall panels. And when a restaurant does that, there's poor ventilation and you're getting really close to being the same as eating indoors. Now, those single table bubbles, the dining bubbles that a lot of restaurants have, those, if you eat in those with just your immediate family, your nuclear family, or your pod, then that would be okay. But if you're adding other people from outside the pod to a little dining bubble, then again, it's exactly the same as eating indoors at the same table. And then just again, talk about eating indoors. The reason why we feel like this is risky is because, well, you have to have your masks off. You're eating, you're drinking, you're talking to your friends, family, you're laughing, and this is what makes respiratory particles travel further, and it can, again, increasing the risk of getting infected with COVID. And a study was done to determine just contact tracing for COVID positive patients, and a significant number of those infected had dined indoors or attended indoor social gatherings where masks are off and there was eating and drinking.
All right, thanks. And I know you already answered this on the chat, but I'm not sure if everybody's seeing it. Somebody asked on the chat, does curbside pickup of groceries or a 5-minute trip inside a school to pick up supplies while wearing a mask violate a quarantine?
Yeah, and I answer that as no. I mean, curbside pickup for groceries, it's essentially contactless. And then the 5-minute trip inside of school, well, again, you're wearing your mask, which is great, but also the timing is very short. It's less than 15 minutes, so that would not violate a quarantine.
Thank you. Jonathan, I'm going to go to you with this next question. One parent wrote in that to go to the pediatrician's office, they have to walk through an area where COVID patients are being seen. They are screening everyone with a temperature check and the screening questions. And the parent wants to know, how safe is it to walk through that common area?
So that's a great question. Thank you. And I think most of us have offices in medical buildings where there are other specialists and specialties, some of which include maybe some imaging centers, some public outpatient lab facilities, and also some immediate care facilities. And as we can do our best to screen who comes into our office and why they should or should not come into our office with symptoms or not, we can't control, unfortunately, necessarily what other offices do within our building. So if that is the case, and I believe it is the case with one of our offices, we would love to know about it, because we've heard about that and we've taken steps with the building to try and figure out a system where not only do people not stand in the public access corridor waiting for access to COVID testing that may or may not be symptomatic, but at the very, very least, they should be masked and social distance. And so we're working with, and if you have a concern about that, I would suggest you talk to your pediatrician group, and we will work with that, that your pediatrician will work with that building to try and eliminate exposure to anybody who may or may not be waiting for a test or symptomatic.
Thank you. Rachel, another parent sent in a question about the chiropractor that she visits. She says that it's a quote unquote maskless facility, and says that they don't screen when she comes in about questions or temperatures, but they do wear a mask when they're in the room with her and her family. Is it safe to visit a place like that?
So I'm not quite sure what they're talking about with, so first of all, if there is a place where people are indoors with people outside of their household, they should all be wearing masks. I mean, that's non-negotiable, and they should be more than 6 feet apart. So I'm not quite sure what they mean by maskless. Maybe, I don't know, when they actually have their services, they take their mask off. I'm not quite sure what that means. But I would recommend that right now, nobody does anything, without, that you're not seeing anybody outside of your household without a mask, indoors and even outdoors. I go walking along the Forest Preserve Trail and I see people walking together who are obviously not in the same household, and they try and stay 6 feet apart, but they're not quite. And they're oftentimes, especially when someone comes the other direction, they're walking shoulder to shoulder, and both of them without masks. So I would recommend, especially right now with this surge, until a good vaccine's available, until we all have immunity, I would recommend that that anytime you interact with people outside your home, you wear a mask, wash your hands, and keep more than 6 feet apart.
Thanks. All right, one last question. This one came in privately. One parent asked, I have a family member with COVID with symptoms and a strict quarantining plan for 14 days. He has been symptom-free now at day 11. I was going to wait 3 days after symptoms to keep him quarantined. Is this the right approach? Jonathan?
So I can chime in on that. I think that for that individual with COVID symptoms, as long as they are recovered and recovering, and it's been 10 days plus the 24 hours, then they are not technically considered contagious. I think the thing that's a little bit confusing and misleading is that the household contacts, really the exposure needs to start with the last day of symptoms. So you're talking about 14 days of household contacts with that last day of symptoms. So if that individual is recovered and chooses not to need to be quarantined anymore, that's fine. But then you've got other household contacts that are still that have been exposed to this person that still would need to isolate for an additional 14 days.
Well, I mean, what you're saying is, so like, for instance, with my 16-year-old son, we've been able to put him in a room by himself with his own bedroom, his own bathroom. So our quarantine goes 14 days, his is 10. However, if it was a 3-year-old who's in the house with everyone else, we have to wait till their 10 days is over and then do an additional 14.
Exactly.
But because my son was 16 and able to quarantine on his own, our 14 days starts when he tested positive.
Right. Yeah, very confusing, but yeah.
Yeah. All right. So I lied. That's not the last question. Somebody else sent in a question that I think is a good idea to answer. And I'm going to send this one to Dimple. Can you get COVID more than once? And how long before you can get it again?
So this is another question that's been researched a lot. And right now, I actually recently looked at the CDC guidelines, and what they're saying is that if someone is positive, then for 90, what they're saying right now is for 90 days, it is very unlikely that they would get COVID again, and they don't have to get tested within that 90-day period. As far as getting it more than once, I bet you we don't know, probably can. That's why if you develop symptoms after 90 days of having COVID, you have to think about, maybe this is COVID again. So even though you've had COVID once, it doesn't give you free range to be maskless and be involved in these risky activities. You could get COVID again, and you could pass it to other people.
Right. And just to reiterate, the immunity that you have, nobody really knows how long it lasts. 90 days is probably a good bet for most people. Some it may be longer. And that story obviously is still being written. We just don't really know. We just haven't lived with this virus for long enough to know. So it's a fluid situation. All right, it's just a little past 7, so I want to respect everyone's time, and we're going to wrap up. I do want to remind you again, this has been recorded. An email will be sent out to all the registrants with the link to the recording. It will also be up on our website, pediatrust.com. And for those of you who had questions about the mental health aspects of this and how This can be isolating and anxiety provoking. Our last Q&A session that we had in November focused on mental health and COVID, and that is also on our website as well. So you might want to give that a look for some more information. All right, I want to thank everybody for participating, especially our panelists, Dr. Damani, Dr. Goodman, and Dr. Kaufman, and all of you for sending in such great questions. And I hope that everyone has a healthy and safe holiday season. And let's hope 2021 is a lot better than 2020. Thanks a lot and good night.
Thank you.
Thank you.